Hello, everyone. So today we are talking to Dr. Green. He is an expert in dermatology, and I just would love for you to go ahead and kind of introduce yourself and tell the audience a little bit about what you do and who you are.
Thanks, Taylor. It's an honor and a pleasure to be with you on a podcast because your social media presence is so well known, and it's a privilege to be here with you. So I'm a board certified dermatologist and a clinical professor of dermatology at George Washington University School of Medicine in Washington, D.C. And what it means when you're a board certified dermatologist, it means you're an expert in hair, skin, or nails. And what's different than online, an expert can be anybody who says they want to be something. But I think it's important for people who go online and look for credentials. Make sure they're talking, when it comes to dermatology, they're talking or listening to an MD or listening to what an MD, doctor, board certified dermatologist writes, because on social media anyone can be an expert, and that doesn't mean you have the credentials and the experience of 4 years of college, 4 years of medical school, 3 years of residency, and then for me 25 plus years in the field treating patients. So that's so important because there's so much out there that's misinformation on social media. And as a board certified dermatologist, I think that's the reason I'm on social media, is to combat the misinformation and try and bring out real scientific information for people out there so that they have a legitimate source that they can trust.
Yeah, no, that's awesome. I love that. I think that that's great. There, like you said, there is so much misinformation on social media, really in all industries, but especially in the medical field. It's so important to kind of debunk some of those myths that are out there. So one of the things that kind of when I was learning about you and what you do, I know that you have participated in a lot of clinical trials, which is amazing, bringing new treatments and new medicines and everything forward. So, can you explain kind of what the benefits of some of those clinical trials are, or maybe your biggest thing that you've discovered while doing those clinical trials?
So I think clinical trials are a great way for patients and for me on both ends to learn about new medicines, experience new medicines, and be part of the future before the future is here. So I'll give you an example. So not all clinical trials work out, but I'll give you an example of something that did. And actually 90% of the things we do work out, because we work with pharmaceutical companies, not directly, but through what's called a clinical research organization, who's an intermediary, so we know the pharmaceutical companies aren't influencing the outcomes of the trial. But we work with these clinical research organizations who are sponsored by pharmaceutical companies who have developed new medications and treatments for patients. So I'm working on the clinical end, not on the bench work, the basic science end. So I actually have medications that we try out on patients that are vetted before they get to me. So I'm usually in the late stages of clinical trials where the medicine's originally been vetted and found to be safe. We just have to find the correct dose and the correct way to use the medication to see how well or if it does work compared to either another medicine or just a placebo, a fake medicine to compare it to. See, because a medicine has to work better than the placebo. You think that the saline or the medicine has no effect, theoretically, to get it approved by the FDA, because it's all about getting approved by the FDA when it comes to a prescription medication. Most of the clinical trials I do are prescription medications, some are not. Those are over the counter. We can talk about that separately. But keep going back and digressing, I'll give you an example of a medication that got FDA approved recently in the past year, and that's a medicine for dandruff, for severe dandruff, called seborrheic dermatitis. And we worked with a company to try out a foam for seborrheic dermatitis. It was a very novel therapy that's non-steroidal. It's not a steroid. It's very safe, and it's not an antifungal. Some people use antifungals for that. It's a new novel way of treating seborrheic dermatitis. Patients who had seborrheic dermatitis and tried prescription medications for years came to my office to participate in this clinical trial, and they just almost all of them left amazed. They'd never seen or experienced anything like that. And they couldn't wait till it came to market. And some had to wait 2 or 3 years because it takes a while for the FDA to approve things after a clinical trial. But these patients, myself, got to experience improvement in a condition they never thought they could get improved. I mean, they came in very sad, but they finally found a medicine, and now it's available to the public, like I said. But this is how things get available to the public. But clinical trials, you're part of the future before it's there. And I'm part of the future, and we get to publicize that future, write in medical journals about that future as a clinical trial investigator sometime, and that gets the word out. And it's new experiences and new types of medications, to me, that bring out the forefront of innovation that our patients get to experience and I get to experience.
I feel like that's very cool what you said about kind of being a part of the future as it's coming into existence and being a part of that innovation and those first people to be able to experience this new thing that is helping people everywhere to really fight what they're struggling with. So that's amazing that you are such a strong proponent for clinical trials and helping bring that innovation to the medical field. What are some of the most exciting advancements in dermatology and aesthetic treatments that you've seen come from clinical trials? Would you say most recently it was kind of the one that you just talked about, or is there any others?
There's a lot because I've got a long career. So in the past 25 years, so much has changed. I'll start with aesthetically. Aesthetics, the advancement of wrinkle fillers and botulinum toxins has revolutionized minimally invasive treatment of aging skin. And they're very simple in-office procedures, which I should emphasize are medical procedures, and there are medical spas that do this. I am scared when patients go to a medical spa because you're not having a board-certified dermatologist or plastic surgeon, or someone who works in a board-certified dermatologist, plastic surgeon's office, a registered nurse, or something like that. Medical people don't remember they're medical treatments, and you can't take a weekend course and expect to be able to give these medical treatments to patients. It's not the way medical treatments work. So, but these have been innovated in my career. There was no such thing as botulinum toxin or wrinkle fillers, and it was an idea of a friend of mine in the 1990s, Alistair Carruthers, who unfortunately he recently passed away, but his wife is an ophthalmologist. He's a dermatologist. They're in Canada, and they noticed that his wife, an ophthalmologist, noticed that she would give botulinum toxin, which is FDA approved for strabismus, which is eye muscle, eyelid. It doesn't stop moving. It weakens that, and it stops when your eye muscles, your eyelid can't stop moving. And then they thought maybe it could relax wrinkles. They made the connection because he's a dermatologist, she's an ophthalmologist and was using it. And lo and behold, they found that when they put it in around the muscles here, when you squint, the muscles don't work as well. They get attenuated or weakened, and the wrinkles go away. And they brought that to manufacturer of Botox, which was the only botulinum toxin at the time. And that's what started this whole industry of botulinum toxin to treat wrinkles. And that doesn't just treat wrinkles around the eyes, of course, it treats forehead wrinkles, frown lines, can affect the neck, and lift up your smile a little bit. There's so many uses for botulinum. Masseters that are, when people clench their jaws a lot, it can weaken that and relieve a lot of pain and stress. So there's so many uses that have expanded that in the last 25 years, all done through clinical trials, and I've been a part of some of those clinical trials. So that's a big innovation aesthetically. In terms of medical treatment, wow, the world for psoriasis has completely changed, and I've been lucky to be a part of that through clinical trials as well. We have medications to treat psoriasis that, I mean, you couldn't even imagine. People who have psoriasis all over the body now are completely clear with injections, and once a month or once every other month, something like that. Just one injection, and the psoriasis clears up. We had nothing like that before the turn of this century, and these medicines keep improving, and people with psoriasis no longer have to suffer with psoriasis. It's just amazing, But now the new innovation, which is up and coming, and I'll give your listeners a teaser for it, is that these medications that are injections are now becoming, in clinical trials, pills. Okay. So now you have to take the pills every day. It's not once every 2 or 3 months, but you don't have to give an injection. And the innovation is it's the same type of mechanism of action to control your psoriasis with a simple pill a day. And those are now, they haven't been proven yet, but the early advances show that we can change these injections into a pill to get similar results that you would have with the injection. So in the near future, if things go according to plan and the clinical trials work out as we think they will, people have a choice. Do you want to take an injection once every 2 or 3 months, or would you like to take a pill every day? What's easier for you to get similar results to control your severe psoriasis? And so we're innovating, constantly innovating. So, and psoriasis is innovating, and so are other fields in dermatology. But it's an honor and a pleasure to be a part of it and have my patients experience, like I said, the future before it comes.
Yeah, no, that's amazing. Especially, I feel like injections a lot of times have a very negative connotation towards it. So a lot of people may be more hesitant to do that, but with a pill, they would be a lot more open to doing that rather than the injection. So that's awesome. So I guess one of my favorite questions to ask everyone is, so as a dermatologist, and I know you have a lot of other things going on. I know you've helped push forward legislation before within this industry, and really just are an expert in everything that you do within this industry. So what does your day-to-day kind of look like in your all of your positions that you fill?
It's a busy day. It's sort of nonstop, as you can imagine. But it's nice. My children are older, so I have much more time to devote to important things. And this is over a career. I wouldn't expect every person, especially with young children, to get involved like I am now. There's a time for everything, but it's always important to stay involved, to do what's best to help our patients. And I'll give you an example of what happened. I started about 15 years ago. When my state, I noticed that there were lots of med spas, and they were people giving botulinum toxin, wrinkle fillers, and doing all sorts of treatments on people that are medical procedures. It's very dangerous. People come to me with eyes closed, all sorts of side effects and swelling from going to these places. And it bothered me, but there were no rules. I mean, it was legal for them to do it. So the practice of medicine is state to state. So I went to my state legislature with, not myself, with all the doctors in my state on behalf of the State Medical Society, which I work with. I'm on the board of the Legislative Committee of the Maryland Medical Society, and I was president of our local county medical society. So you work together. You don't do it alone, because to work with the legislature, you have to be you have to show numbers and interest from all over the doctor world. And we showed the danger of having these medical spas do these things. So at least in my state, you now have to be an RN or a nurse practitioner to give these medications if you're in a med spa, or a physician, or working under a physician like a dermatologist or plastic surgeon in order to give that. So you don't have random people who take weekend courses in general doing these things in medical spas and unlicensed facilities. They're medical procedures. Now, we'd like to make it a little stricter, but that was a big step forward. So that's a big advance. And now the big push for us as dermatologists, this is a completely different thing, is on a federal level, is that the payments from Medicare to physicians, not just dermatologists, has gone down so much over the last 25, 30 years. It's like 30%, 25, 30% less, that physicians are either closing their office, like my primary care doctor for the last 20 years, just December said, Larry, I can't afford to practice anymore. I'm 65 years old. I'm just going to quit. I can't make ends meet with payments from Medicare. And so he closed his practice. So I don't have a doctor right now. I'm looking for one. The problem is it's so expensive, because all the doctors I can find are what are called concierge. Just so it's not. You have to pay them $3,000 a year for the privilege of seeing them. And then they bill insurance. Because the reason they do that is they can't afford to see patients with insurance company and Medicare payments. So it's very problematic in this country for people to see primary care doctors and doctors who participate and see a lot of Medicare, because they can't afford to do practice. Another thing that physicians are often doing, and dermatologists have done this a lot, is joining large groups that are run by Wall Street called private equity. But I don't do that. But the allure of a big group is that there's a lot of things they can centralize and take care of for you, and you don't have to worry about Medicare payments. It's their bother. So they pay you a salary, or based on how many patients you see, you can get, based on how much you bill, a percentage of collections. So that's an idea, but joining a big group, it means you give up a lot of your independence. You have to do what they say, whether you think it's best or not for the patient. And there's a lot of consolidation and things that are outsourced that you can't do in your office. So, it's big medicine, not individual medicine. It's part of corporate medicine. But unfortunately, that's the way it's gone. So big push for dermatologists is to petition Congress to allow Medicare to keep pace with inflation, which it hasn't, so that doctors can get paid at least according to inflation, and not go out of business, not afford to be able to practice like they have now, or have to charge $3,000 a year to patients in order to see them, in order to practice medicine and keep afloat. So that's our big new push.
Yeah, wow, that's awesome. I mean, it's not awesome that it's hard for doctors to stay in business, but it's awesome that you're pushing forward for that to be a new initiative in your state that you're really focusing on, with helping, I'm sure, tons of doctors, but not only doctors, but also all of their patients that are going there to see them too, because, everybody needs their doctor.
Right. No, it's not really the doctors. Yeah, we want to help the doctors, but it's really the patients, like myself as a patient who's suffering, because I can't find a primary care doctor to treat myself, because there are none who don't charge a yearly fee. so you can afford to stay in business. So I'm selfishly trying to do it for myself and all the patients out there to make sure they get the best medical care, because that's what America's about. And I'm afraid we're slowing down in that. So, and that's a federal, not a state initiative. We have to lobby Congress because Medicare is part
Okay.
of the government stuff. So it was a state on the state to fix and make life safer for our patients for aesthetics. But this is a federal fix, and we're working on it and trying to get Congressmen to sign on. And that's a big push by my national organization right now.
Thank you for doing that, for sure, because everybody, like I said, needs their doctor, you know? So it's definitely for the patients. So leading in kind of to my next question a little bit, how this is very, very patient focused. How do you approach skincare treatments differently for your patients, kind of based on whatever age they are and also their different skin type? Because obviously, as you know, as a doctor, everyone's different. So everyone needs very different care. So how do you kind of approach that?
So yeah, that's the importance of seeing and talking with the patient. I personally am a big believer in seeing someone and working with someone in person. There's a lot of telemedicine or televisits going on, and I don't participate in that because you can't really get a sense of what the person needs just by looking at them on a screen. Like, I can't look at you and say, Taylor, you need this medicine, or this is best for your skin. You have to see and touch and be right near the patient in a three-dimensional level. And I think that's very important. And I want to do what's best with the patient. I don't want to estimate or guess based on a two-dimensional visit what's best for the patient. So everything is very individualized. As a dermatologist, I want to get to know my patient because everything is different. I will not give the same medicine to two different people who have two different needs. And that's another good thing I think about living in this country is we have lots of choices. They don't necessarily have choices in other countries. They just have certain medicines. We are the innovator in the world, and we have lots of choices. And I want to make sure my patients get the best choice. So what's best for you may not be best for someone else, and it's certainly not cookie cutter size. It's not one size fits all. So yeah, that's very important to do, and I can't say what's best for you, like I said, will be best for someone else. It takes that sitting and talking and touching and feeling and getting to know the person.
I think that it's really cool that you have a very personal experience with all of your patients, because obviously we live in this world where a lot of things are very digital, virtual, like you said, telehealth, we have social media, but it does take, as a dermatologist or a specialist really in any field, to actually be able to see the person and know their unique needs. So yeah, I think that that's really cool. In your opinion, and we already talked about this a little bit earlier, but what are some of the biggest misconceptions about dermatology or skincare that people often have, maybe when they come to your office, or that people have brought up to you?
There's so many misconceptions from social media, and it's gotten worse and worse and worse. And it's not just social media, it's the internet too. I'll give you an example, and it just shows that even sometimes reputable sources aren't accurate, or I wouldn't say, maybe the people are misreading it. So I saw a gentleman earlier this week, and I can go on from this, but this just is in my mind, happened earlier this week. And I told him he had some benign keratoses and sun freckles on his face. And he email messages me on the portal that they're not. He has liver spots. And I said to him back, well, the liver spots, it's not a medical term. I don't know what a liver spot means per se. And he says, well, no, it says on the Mayo Clinic, a liver spot is from sun damage. And I said, you mean a sun freckle? Or solar lentigo is the medical term. And he says, no, a liver spot. And I said, that's not a medical term. I think you're misunderstanding. It does not come from the liver. It's from sun damage. But that's a misleading thing. Sometimes you can get people misunderstand what's online. I'm sure Mayo Clinic did not say liver spots come from the liver, but people can take and get misinformation from real information, or just get misinformation online. So another thing, people will come to me and say, I found out that my acne is worse, or my psoriasis is better with gluten, being gluten-free. And I'm like, okay, if that works for you, great, but I can't extrapolate that to the general public, because while there's evidence that shows that some people may get better, their psoriasis may get better, majority of patients don't get better when they're gluten-free. So I can't make that a general principle. And our observations are based on scientific studies. There's a lot of clinical trials that have tried to restrict gluten in psoriasis patients, and mostly it hasn't worked. But there may be some people who are sensitive to gluten and makes the psoriasis better. If they're allergic to gluten and that makes a stress in their body, of course it's going to make their psoriasis worse. But in general, the principle doesn't work. That's another example of taking information and applying it to, thinking it applies to everyone when it may not apply to you. I've seen people on social media saying that drinking goji juice or some other berry juice makes their acne better. It's the best treatment for acne. I think they're probably being paid by the juice company. I don't know that. But they swear by it. And so, things like that, get the correct information out there, because you got to look at the science. And the cause of acne is hormonal. It's not the juice is not a hormonal thing. So we want to get the science out. We want things to make sense for everybody, and that's what your board certified dermatologist can do, is make sense out of the science. And that's
Yeah.
important.
I feel like we see a lot of crazy stuff on social media, especially with skincare, where it's like, oh, put whatever oil all over your face and it will heal your acne or make your wrinkles go away, or, it's gotten really, really crazy. So I appreciate you just kind of even bringing that up. And I mean, I'm from the WebMD generation where we would have, like a headache and you're looking it up online and it's saying something crazy is going on, So I appreciate you definitely kind of going into that a little bit further.
Yeah, I'll give you
With
another
your,
example. Oh, real quick, I'll
go
give you another
ahead.
example. Beef tallow to treat acne. Putting fatty
Yes.
beef on your face to treat acne. That's going to clog your pores and make acne worse. I don't know where that idea came from. It's not a good idea. Slugging is another idea. No, I'd say slugging, I don't know if you've heard of that. That's putting Vaseline or snail juice, like Vaseline, on your face to help moisturize it. There's plenty of easier ways of putting gross snail juice on your face to moisturize it and do what that can do a lot better. So I'm sorry, I could go on, but I'll let you go on from here.
No, you're totally fine. I love talking about those different ones. The beef tallow one always cracks me up because I'm like, if anyone gets close to you, they're just gonna, like, you're gonna smell like ground beef or like a hamburger or something. So it's crazy. And the snail one, I haven't even heard of that one yet, but I'm sure that can't smell good either.
No, it's called slugging, snail mucin. Yeah, I know. I don't know where people get these ideas. No idea. But they swear by it, and people believe it because it's on social media. But you'll never see a real expert, a board-certified dermatologist, come out and say those things are good.
Yeah, no, I 100% believe that. So, with your focus kind of on innovation, what do you see as the future of dermatology besides these crazy trends that are circulating around social media?
Wow. Well, the focus is on innovation in real clinical trials. And we've got clinical trials going on. Like I said, the pills for psoriasis are a big thing. That's new. We have new
Yeah.
medicines, pills for treating a disease like vitiligo, a condition like vitiligo, or hair loss, alopecia areata, which is immune-related hair loss. We had nothing for these conditions before. Well, they're coming. So it's really exciting to see innovations in this, especially to treat people. Over the years, I had patients who just go bald, women who go bald from immune-related hair loss. It's called, like I said, it's called alopecia areata. There's nothing I could do, but that's changed, and we can help grow their hair, get their hair back. So people with deep pigment from vitiligo lose all the pigment in their body, especially with darker skinned people. It's so hard and difficult. That's changing. And those are some of the new things and new therapies that are coming out. Aesthetically, we continue to innovate. We have a botulinum toxin that lasts a little longer now. We have better wrinkle fillers. There's new devices coming out to tighten skin, and we have some out there now. And so we're making things a lot better and improving our lives so that we continue to look better. If I look at pictures of my grandparents, which would be your great-grandparents, you would see they were 50. They looked like they were 90. Their hair was gray, and they would have all these wrinkles and sagging. You don't see that anymore. And I think that
Yeah.
for your generation, when they get to be that age, you're going to look so much better and so much younger. It's just amazing the innovations going on.
Yeah, no, that is amazing. I feel like, yeah, medically and aesthetically, there is so much going on in the industry right now. And I feel like, especially with aesthetically, there's a lot of talk about, how do you keep your skin youthful and how do you maintain and prevent skin aging. So what do you think, like, as a dermatologist, your best advice for people would be for maintaining youthful skin?
So let me first say that depends on your skin type and how sensitive or not sensitive your skin is. So that's one thing that's, like we talked about earlier, very individualized. So I cannot say that one thing, well, maybe I can say one thing, but in general, what's good for someone may not be better for someone else. That's why it's so important to see your board certified dermatologist or see the esthetician that works in your board certified dermatologist office, because you can get prescription type stuff that will help you, that's designed and tailored just for you. It's not one size fits all. One thing that is good for everybody, you should be doing every day, is sunscreen. Moisturizer with sunscreen. And if you have darker skin, I would want to make sure that that moisturizer with sunscreen is tinted. It's got some color in it, like a makeup base. Because if you have darker skin, and even if you have lighter skin, it's not bad to have tinted. But it's not just the sun that can age our skin. Even visible light can age the skin, as well as infrared light and things like that. So tinted sunscreens have an ingredient called iron oxide, and that really prevents damage from visible light and infrared light. So that helps prevent more sun damage, not just sun damage, more damage occurring to our skin. And the darker your skin is, the more likely that visible light can also cause aging of the skin and mottled pigmentation in the skin or brown spots. So it's important to protect yourself every single day. It's not just when it's sunny out, but every single day, because we're in visible light as well. Again, you have to have the tint in your sunscreen to protect from visible light. So important. You want to age gracefully. It starts with a moisturizer with sunscreen, even at the earliest age when someone's younger than you are.
Yeah, no. I wear sunscreen every day. I wear a tinted sunscreen actually. So when you were saying that, I was like, "Oh, I'm doing the right thing." Love to hear that.
You're on top of it, Taylor.
So, what advice would you give to someone considering a career in dermatology, especially with an interest in medical innovations in clinical trials, kind of like we talked about earlier? That's been a lot of your career and still is. So, what advice would you give to someone kind of looking to get into something similar as you are?
Well, it's a long haul. First, you have to go to medical school, which is not easy. Then you have to do a residency in dermatology. And I talk to a lot of young dermatologists all the time who are interested in clinical trials, and even medical students who are interested in dermatology as a career, with or without clinical trials. So I think it's exciting, it's innovating, it's a lot of work. You have to keep working at it and try and publish and work with investigators or your professors or your people at your medical school to get involved and get your name out there, because that's the best way, and get to know people. You know, life, not just in medicine, when you think about it, life is about networking and getting to know the right people, because doors open not just because of your credentials, but doors open because of your experience, your life experience, and what you've done with that, and how that's gotten you to know people who can open doors for you. So take advantage of that and do that. That's what you're doing here, and you're building your life here with this podcast. It's going to help open doors for you and get to know people that hopefully can help you as you move on in life, because you know them, if you work with them and they trust you, they know you. So that's, I think, an important lesson to always do, is never forget who you meet you never know who you meet may change your future for the better. And always be on, always try and work with people and be friendly with people, and, not have anyone who's you've had a negative experience with, because you never know, that could come back to haunt you. But more importantly, forget about the haunting part. It's life experience, experiencing life with others, because the more you broaden your horizons, the more likely your horizons will be broadened.
Yeah, no, I love that. And I feel like that applies to just about everyone too. It's like you should be creating a community, creating a network kind of around you of people that have similar interests, people who maybe can mentor you, or help you, or you can bring value to them. You can bring value to each other, really. So I think that that's great advice for really just about anyone. And that was my last question. Do you have any parting words or anywhere too where people can find you and follow along with all of the things that you're doing?
So certainly following me on Instagram, Facebook, TikTok, and YouTube is a good way to message me and follow me. I wish I had my QR code to show you, but you can put it up if you want. It's at dr.lawrencescreen, at dr.lawrencescreen. You have to put the dot after doctor. And
Okay.
my name's spelled like the color. Yes, I'm always welcome to interact with people, because just like you said, you never know who you're going to meet. And I hope you and I get to see each other again, because you never know how this meeting will set up future meetings and help us both advance in the future.
Yeah, no, I love that. I think that that's great. Thank you so much for coming on. And it was a joy speaking to you. And we will see you next time.
Yes, and don't forget to see your board-certified dermatologist. Anything related to skin, hair, or nails, trust no one else. Thanks, Taylor.
All right. Thank you.